Hello, everybody. Let us discuss the key areas that you have to concentrate on for your upcoming June exam 2022. Okay, this is in no specific order of importance, just top to bottom, whatever systems I have remembered, I have placed and given the most important questions that can be expected. So, in central nervous system and peripheral nervous system or your neuromuscular system, you can expect approach to global developmental disorder. Indian Pediatrics May 22, they have given a full guidelines. And recent update on febrile seizures, autoimmune encephalitis, many centers are seeing lots of cases, so you can expect a question there. Movement disorder is standard pa. Okay, you can keep it down the list. Neurocysticercosis, please read and go. Both the treatment part as well as differentiating between TB and a neurocysticercosis on neuroimaging. Migraine and approach to headache, must read. Stroke management and approach important. ADEM, yes. Metabolic encephalopathy, ಇದೆಲ್ಲ IJPP neurology book they have given chapter wise. So you can go through that. Acute flaccid paralysis, both from social pediatric standpoint as well as from your nervous system, you're supposed to read. And as I always tell, read the initial part in Nelson. When you start any system, initially they would have given the diagnostic tests, neurophysiological tests, X test, Y test, ella. So read that initial part. Anatomy or embryology, whatever they have given, read that part. I didn't get time to compile the anat physio questions. When I'm able to do, I'll put it in our Telegram group. Okay. Radiogenomics, again, this is given in the same IJPP neurology version. Epilepsy management, recent advances, surgical management of epilepsy, dietary management of epilepsy, especially ketogenic diet, angalla, they can ask you. Approach to syncope. SMA and DMD, because of the newer treatments, they can ask you. Approach to floppy infant is a standard question, both for your theory and your practical. Your chotu systems, no offense, but not much questions are being asked. But if asked, we will be in soup. So that sort of place this is. Fundus examination in a neuro case or general fundus examination in helping you to diagnose. So they can frame it in any way that they want. Approach to a limping child. CTEV, DDH are standard questions. They can ask the skin reactions. Okay, toxic epidermonecrolysis and your drug reaction, eosinophilia, and systemic symptoms. So those things they can ask. Approach to squint they can ask. Orbital cellulitis. Hearing loss approach, please read and go. Somehow that keeps striking me again and again. So standard treatment guidelines, why I have put this, IAP has been releasing standard treatment guidelines and they have crossed 50 guidelines so far. Read those 50. Okay, you don't have to refer anything else. Extra books, if you don't have time, you don't have to break your head. It is like a question answer format only. You can easily write a short answer if you read those guidelines. Okay, so go through those guidelines. It is given in Indian Academy of Pediatric website. If you just type standard treatment guidelines, you will see that. Then respiratory wise, approach to all your different symptoms. They can ask you stridor, they can ask you pneumonia, they can ask you wheeze. Okay, so basically you should know approach. Genetics and cystic fibrosis, you should know. Asthma, acute exacerbation, pulmonary function test. This is something they are very fond of and they keep alternating almost every alternate year. Okay, so read that. Sudden infant death syndrome, because recently they have discovered this butyryl cholinesterase, which is associated with the SIDS. I think it's butyryl cholinesterase, yeah. So they can ask that. Croup, bronchiolitis, these are all cases that you see on a day-to-day basis, so you can answer. CAP is community-acquired pneumonia. Primary serial dyskinesia, just have a go-through before you go to exam. Okay, because that again, it will come as your persistent pneumonia approach, you will be reading that. But as a standalone question also, know a few points. In pneumothorax, we have discussed pneumothorax umpty number of times previously. Cardiovascular Kawasaki disease, very, very important. Past 2-3 years in one form or the other, they can keep asking this or they keep asking this Kawasaki. Cardiac catheterization. ECG in diagnosis of your congenital heart disease or your rheumatic heart disease. Similarly, echo and echocardiographic findings in rheumatic heart disease. What are all are possible, you write and they can ask. Ventricular septal defect, PDA, standard question. TOF, cyanotic spell, standard question. Timing of surgical intervention in congenital heart disease is something that they can ask. Okay, approach to hypertension, pericardial effusion or tamponade, congestive cardiac failure treatment. They're very standard ones. The difficult things that you will find are catheterization, your ECG and diagnosis. Otherwise, rest everything I think you'll be able to answer. Hematology give a little bit more importance because they can ask quite a number of questions in that. They can ask like your lab assessment, interpret your complete blood count or a peripheral smear in your diagnosis, CBC and histogram in diagnosis. Thalassemia, they can ask about chelation therapy, they can ask about gene therapy. Aplastic anemia, HLH, autoimmune hemolytic anemia. This is looking haphazard because whichever is the most latest things that they have discussed in different journals, I have clubbed. So that's why you're not seeing RBC wise, WBC wise, platelet wise. But these are the areas that you have to concentrate on. Okay, autoimmune hemolytic anemia, please read and go well. Okay, both presentation, diagnosis, management. And your parenteral iron preparations, megaloblastic anemia, all standard. ALL, you're supposed to know everything. Treatment, risk factors, how do you prognosticate? Everything you should know. Then your hemophilia, clotting factor replacement therapy, different conditions, how to replace clotting factor as a treatment, as a prophylaxis, you should know. Hematopoietic stem cell transplant, bone marrow transplant, they can ask. Flow cytometry, important. They can ask in a particular disease or in a particular system, how is it applied. Von Willebrand disease. Transfusion guidelines, you should know for RBC, your FFP, your platelet, your cryoprecipitate. Everything you should know. They can ask anyone separately. Or they can ask a generalized question like transfusion reactions. Trolley, ಅವೆಲ್ಲ you might have to talk. Neuroblastoma ಪಡ್ಚ್ಕೊಂಗೋ. That is something that they can ask any point in time. Similar to your ALL. Solids, you should know neuroblastoma as well as Wilms tumor. These three things we cannot afford to miss. Renal and urology, நம்மளுக்கு steroid sensitive nephrotic syndrome, steroid resistant nephrotic syndrome, we have already discussed. Rituximab as a standalone question they can ask, like for treatment of nephrotic syndrome they can ask, or generally rituximab, how do you use, how do you follow up, what are the things you will look for, they can ask. Approach to hematuria, approach to proteinuria. Then hemolytic uremic syndrome, especially atypical hemolytic uremic syndrome, they can ask as a question. Enuresis, again, very important. Vesicoureteral reflux, UTI, what are the recent trends, treatments? RTA and diabetes insipidus, read the outline at least and go for your exams. Endocrine, only standard questions, nothing new. But these are questions that keep repeating almost every year, at least 1 or 2 questions keep coming. So short stature approach, growth hormone therapy, diabetic ketoacidosis, important because every year they come out with a new guideline. And this time especially they have concentrated on your fluid therapy. Insulin, you can start at 0.05 units per kg per hour rather than 0.1 units per kg per hour in mild and moderate DKA. So those changes they can ask you. Okay. Approach to delayed puberty, precocious puberty, your ambiguous genitalia approach, growth chart. These are all standard expected questions. You can also add on PCOS to your list of questions if you want to read. NICU, remember your neonatology constitutes about 30% of your total marks. Okay. So if you're writing 4 papers, nearly 1 paper ka full mark is going to be of your neonatology, though they spread it over different papers. So read everything top to bottom. That is what I would suggest. Don't miss neonatology because you know this is a place where you're going to get most questions. Okay, so it will be foolish for you to skip areas in NICU. Therapeutic hypothermia, high risk follow-up, ROP, hearing screening, your IEM screening. These are all very important. Okay. So don't miss this ROP, hearing, screen, high risk follow-up part because something or the other every year they tend to ask, every year. Perinatal, neonatal, COVID management. They can put it as how do you manage in delivery room, how do you manage breastfeeding. So any part of it they can ask. Then amplitude integrated EEG, developmentally supportive care, antenatal diagnosis, antenatal treatment. It can be named as fetal therapy, fetal surgical interventions, anything. Respiratory distress syndrome, surfactant, HIE, PVL, இதெல்லாம் very standard question. nothing extra about it. Last time they had asked diaphragm anatomy because we have diaphragmatic hernia. They had asked brachial plexus ka anatomy. You have Erb's palsy. So whatever your pathology is, you should know the anatomy and physiology for that particular problem. So if you know that, I think you'll be on the safer side. Hydrops, non-immune hydrops, read. Polycythemia with partial exchange transfusion, read. Perinatal infections, HIV must, TB must. How do you give prophylaxis? CMV and toxo are standard. Your PICU part, there is lots, to be very honest. Okay. You can read about IVIG, plasma exchange, dialysis, different types of dialysis, what is the indication. Mixed venous oxygen saturation, there were multiple papers on that previously, so I have put that. NIV is something that you have to know. Ketogenic diet, we already told in CNS. Septic shock, surviving sepsis guidelines, initial how much fluid to give, how to give, what fluid to give, colloids, so those part you have to know. Role of CT head in emergencies, inotropes. Acute upper GA bleed, how do you manage acutely? Foreign body in airway, foreign body gut, you should know. Then this part you should know pakka, in and out, because one question will definitely come. Either your fluid disorders, your metabolic acidosis, or your electrolyte disorders, hyponatremia, hyperkalemia, so that you should know. Brain death, end of life care, they can ask. Respiratory failures, type of respiratory failures, anaphylaxis management. Social environmental, adolescent health services, your junks, substance abuse, nurturing care for early childhood development. This is given in IP, okay, Indian Pediatrics, one of the journals that is there. POXO, adoption, MR campaign, anemia, Muktu Bharat. These are all standard questions that keep coming. One or the other keeps repeating every paper. Statistics concentrate because Indian Pediatrics, regular Indian Pediatrics, every month they have a research methodology section where they have started discussing one topic in every issue. Okay, so study design types, observation study, case control study, cohort study, diagnostic studies, interventional studies, systematic review, meta-analysis, survival analysis, positive predictive value, negative predictive value, sensitivity, specificity, your analysis, forest plot, Kaplan-Meier, box plot, regression analysis, test of significance, test of normality, Mann-Whitney, Kruskal-Wallis, ANOVA. I know these are too many tests. See, but they have already asked forest plot and they have previously asked on Kaplan-Meier also, I think. So chances are they can ask you box plot or one of these tests. Okay, so that's why I have put these up. Ethics in research question, how do you frame a research question? Blinding in research, bias, then p-value, plagiarism, odds ratio, relative risk, and attributable risk they can ask. Something else I was remembering when I was telling these tests. What was written? Now I am not recalling. Somewhere near this Mann-Whitney, Kruskal-Wallis, when I was discussing. Okay, if I remember, I will put it in a Telegram group. Something I wanted to tell you guys. Okay, if I remember, I'll tell. Let's not waste time. GIT la cow's milk protein allergy, read. Okay, similarly, your celiac also you read. Celiac, I forgot to write here. But read celiac, especially your non-classical celiacs, basically. Pediatric acute liver failure guidelines, read, because April 2022 they have come up with new guidelines for management. Constipation, GERD, IBD, idella standard guidelines. Chronic diarrhea approach, standard question. Acute pancreatitis, I have put because it just kept catching my eye. Neonatal cholestasis, again, you guys know how to differentiate into a probable surgical cause or a neonatal hepatitis sort of, and I'm sure the flow chart. Autoimmune hepatitis, portal hypertension. When you're reading about acute GA bleed, anyways, you will read about that. Genetics, one of these tests will keep repeating. Next generation sequencing, clinical exome, whole exome, enzyme replacement therapy, gene editing, CRISPR technology, they can keep asking. Nutrition, again, junks, vitamin A and D, important, zinc, magnesium, important. Your breastfeeding, complementary feeding, breastfeeding and COVID, hidden hunger, triple malnutrition. Then your micronutrients, they can ask you specifically. Obesity approach, super ORS versus your regular ORS. Vaccine illa the intro part, please read well. What makes them decide what vaccine to give for which part of the country, and what makes them decide the schedule of vaccination. Then what will happen if there is an adverse event following immunization? How do they maintain the cold chain? Vaccine vial monitors. So the initial 4-5 chapters in your IAP guideline book on immunization, read. Rather than individual vaccines, they are very fond of asking this introductory part. COVID vaccines, read. Dengue vaccine, malaria vaccine, those are all recent ones. So read up what it is. Okay, and vaccination in special situation will be immunocompromised state or missed vaccination. Or if they have received any products, what are you going to do? Okay. Pneumococcal vaccine, rabies, mission Indradhanush. Infectious diseases, it's very vast, Chirya. So I have reduced it to whatever I found was important. Hand, foot, mouth disease, because it has come back in a fancy name called as tomato fever. So read that up. MRSA, because I did a seminar on MRSA. Febrile neutropenia, enteric fever, we are seeing more and more cases. So read up enteric fever. Okay, jokes apart. Read enteric fever. Diphtheria also. And fever without focus, pyrexia of unknown origin. These approaches are very important. Periodic fever syndrome, autoinflammatory, or your inborn errors of immunity. So they can name it in any way. So read that. It's not exactly coming under infectious diseases, but fever, I had just put it there. TB, you should know everything in and out. They can ask about the diagnostics. They can ask about your IGRA test, your expert TB ultra, your line probe assay. They can talk about second line anti-tubercular treatment, first line anti-tubercular treatment. They can ask anything. But mainly they will concentrate on diagnostics of tuberculosis. Even I did not know where to put these topics under, so I have put it under MISC. Missy வருது திருப்பி திருப்பி these patients பார்த்து okay. So screen time, digital wellness, read, because it's one of the hottest topic in all the journals that I have seen. Sleep studies, go through Indian Pediatrics 2021 November it is there. In Nelson also there is a sleep chapter. Okay, so what is normal, what is abnormal, you see. If you want, you can go through the EEG part also. It's not in sleep, but general I am telling. Neuro part, I forgot to mention EEG. Now I am remembering. Okay. So EEG in diagnosis, they can ask you. Gaucher's disease, because there was a guideline on it. Approach to inborn error of metabolism, end of life care, learning disability, ADHD, ASD, either one of these they can ask. Technology revolution in healthcare, this was in one of your IJPP papers, I think. Approach to inborn errors of immunity, which is your autoinflammatory syndromes, your periodic fevers. Then SCID, CGD, XLA. So these are all primary immunodeficiency disorders, A gamma globulinemia, chronic granulomatous disease, and severe combined immunodeficiency. Hereditary angioedema, then sleep medicine, I was talking about. Read up in Nelson, just a few pages, but question can be asked in that. Pica, tantrums, these chotu questions, they are fond of asking nowadays. So that's why I had put up breath holding spell dyslexia. Approach to isolated speech delay. Floppy infant, you talked about isolated motor delay. This is isolated speech delay. Urea cycle defect, go through. Atopic dermatitis, just management. Urticaria. If rheumatology they are going to ask, it's going to be on either JIA or SLE. Yes, I think that's it. So all the best for your exams. Any questions, reach out to me in Telegram group. I'll be happy to answer. Okay. All the best and bye-bye.